This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. We appreciate it. I'm Kyle Wiggs. Our guest this morning, Thomas Dravar. He's a psychotherapist with Mon Health, Wedgwood Primary Care, and Psychiatry. Good morning. Thanks for coming on.
Hey, good morning. And so I'm a licensed independent clinical social worker.
Licensed independent social worker.
Yep, clinical social worker. Exactly. You got it.
We got it. Okay, so we're going to talk to you about men's mental health coming up in just a moment. But one of the things that this month is focused on, June, is colorectal cancer awareness and prevention month. So just take a moment real quick as someone who's involved, in the healthcare industry. How important is it to get screened for that, and how easy is it? It's as simple as a colonoscopy, correct?
Yep, that's correct. And, it's one of those things, preventative health is just such a massive part of overall wellness. So, when we're talking with our PCPs and just engage in any type of health, just to become educated and make sure we're getting screened and signed up for all of the preventative health, health assessments we can, just keeps us on the right track. And then we don't have those scary nightmare type, issues coming down the line eventually later.
Okay. So keep that in mind. It's just very simple. It's a simple, not that procedure, not to make light of it. It's a commitment for a couple of days, but it's something that every man should do, every woman should do for that matter. And, get yourself screened. It's as simple as that. Okay. So your focus, your area of expertise is mental health. And let's talk about some issues that you see, that you deal with males in particular, some issues that men may be struggling with.
Yeah, there's always these stigmas and things like that around men's mental health and in physical health as well. A lot of times I will see an older gentleman, maybe even their 40s or 50s, and they're coming in and they're saying, "This is the first time I've spoken to someone about this, and I've had the opportunity to maybe be the only person they've spoken about things with." And so I'll have somebody that says that I'm going to talk to my wife about this, or I don't know how to speak about it. So, I may be the first person that they're actually talking about these things that they've struggled with, even as kids, and they've held on to it for 30 or 40 years. And so it's something that we see that, for whatever reason, there's just that stigma and that misunderstanding that men's mental health, it's just something that could be pushed away or just dealt with on our own. But unfortunately, that isn't always the case. And, these things start to bubble up as time goes on.
So a situation where someone has an issue that has gone unresolved or buried, so to speak, like you say, they manifest in depression and anxiety, right? Those are among the top symptoms.
Exactly. Yeah, exactly. And then you'll have some post-traumatic stress, depending on what they've been through. And then these issues come out in different parts of life. It'll come out in, struggling to maintain relationships, trouble sleeping, just unfortunately, coming out in every area of life. So even though we think about it as just, mental health and depression or anxiety, it's something that manifests itself just throughout life. And people have trouble focusing on, what's important to them. And it's a massive barrier.
So what are the symptoms you see? You have an individual who's going through life and they're, they get up every day and go to work and do their job, and they have maybe a wife and a family, and they have some hobbies and they like to get outdoors. And then all of a sudden something changes. What type of symptoms are we talking about, and what should maybe the loved ones be looking for to indicate that this person may be struggling?
I always just think about if it's different than you typically are. So if you are enjoying those hobbies, or maybe you enjoy spending time with your kids, and you start to become irritable about those tasks or spending time, a lot of fatigue, you can feel a lot of the physical symptoms, just worn down, headaches, things like that. Just this struggle to complete the tasks that you normally want to do, and then you also see isolation from family and friends, and stopping to do things other than what your hobbies were. Maybe you're just sitting and kind of just numbing out, or some self-medication you'll see because maybe we can't deal with the symptoms that we're dealing with, and we'd rather maybe use some substances or alcohol to try to numb those painful feelings and thoughts from coming in.
One note here says that suicide among males, the suicide rate is significantly higher. You talk about suicide being a permanent solution to a temporary problem. So again, what should we be looking for in our friends and family members that may be suicidal? What can we do to try to prevent that or get them help?
And that's just like we talked earlier. I think prevention is the hugest part, and it's hard to catch those things. Going back to those symptoms, if someone's isolating or maybe they're difficult to talk to, it's hard to catch because maybe you aren't talking about it or saying to someone that your symptoms are getting worse. So that's where we can really look at more of the behavioral changes. If somebody's really into fishing or going to sporting events, if it's something that no longer becomes important to them, those changes in what they're doing, maybe we're looking at more of the physical stuff rather than relying on those conversations and, the verbal stuff, that if somebody were more open or speaking to a professional that we could catch. So we're looking at more of the behavioral things, the isolation, just kind of giving up on some of those things that really were important to them.
Okay, so we've started with a lot of negatives here, some behavioral issues that people have. Let's talk about the positives. What can be done if an individual is really struggling and they may be listening to this, or someone who loves them's listening to this? What are the steps they need to take that to get some help?
I think the first thing is just within ourselves, is just knowing if you're not able to do the things and enjoy the things that you did before, nothing wrong with you. You're still who you are, but you're struggling. And so starting anywhere, even if you're not ready to talk to a therapist yet, that is fine, but talk to somebody or put yourself out there a little bit. And so even in therapy, I'll tell someone if they aren't so sure about therapy, come in and just sit. We don't have to talk about anything, but just whatever it is that you can do that, even if it's only a first step. Because once that starts, or you start talking to a friend, you'll see that it's something you can do. It's something that's not as scary or overwhelming as you thought it would be. So just start anywhere. Let a friend know. Call in and talk to a therapist, and don't worry about having a full session. Just come in and sit on the couch or the chair, and we'll start slowly. But anything you can do is important to try to do.
Mm-hmm. PTSD is something that we often equate with military people who have been in combat, and I guess first responders, right? They're the folks that live among us every day that have to deal with the worst, someone's worst day every single day. So can you define that a little bit, what that term means? And let's get into some treatment or some things that people may be suffering from PTSD, what they can do about it.
Yeah, so we're looking at, this exposure, either you experience it or you witness a traumatic event. So even if you're a part of a crew and, you're, like you mentioned, is a first responder, that event may not be happening to you, but while you're there, you're experiencing that through, witnessing it. And so we'll see that these frightening thoughts and memories are constantly there. Things may be, a little bit more often. We might have those thoughts throughout most of the day. Sometimes those triggers, bring those things out later. But we'll see people that, are kind of keyed up, we'll say. They're a little more hyper-focused, hyper-fixated. Their mood starts to change negatively. People may even try to avoid what it is they're struggling with. Like if somebody had a car accident, and they're still not beyond that and past that and working on it, wanting to avoid that altogether. And you'll see that affect negative parts of, affect their life negatively because they're not going to work or other things because of wanting to avoid that trigger of driving. So it can really be different for a lot of people, but just that exposure is something that doesn't just go away.
Yeah. And again, with first responders, when they deal with something like an accident or a fire or the flooding that we've had just in the last week, and I would imagine, that adrenaline flows, they're doing what they can to help people and to be there, and then they have to go home, right? They have to go home and kind of to try and relax and try and put it out of their heads. I would imagine that's very difficult.
It is, and that's where even going back to just doing what you can do, a lot of these crews of first responders and everyone else, very tight-knit, and so by even just talking about some of that stuff, after it happens, like I'm having trouble sleeping, others can help us identify if something's been going on beyond what's typical. So if someone's saying 2 weeks after an incident that they're having trouble sleeping and the rest of the crew maybe isn't, that can allow that person to see that, hey, maybe there's something more going on to this. Maybe that wasn't a routine call. And so that's what we're looking at, is things beyond like what would be typical in that situation. Not for me, who's not a first responder, but if within the first responder community, if that's something that maybe is going beyond what would be typical for a call, by mentioning that, they can start to be more aware of, hey, this may not be that typical call that affected me in that in a typical way. So let me get some more support, some more help with that.
We are visiting with Thomas Drvar. He's a licensed clinical psychotherapist, Mon Health Wedgwood Primary Care and Psychiatry. And before we take our first break here, why is it that men struggle with bringing these things out into the open? Why do men have a tendency to kind of swallow these emotions perhaps more than women?
It's one of those things that we kind of teach our kids, rub some dirt on it. You're a boy, boys don't cry, be tough. And, if we start to learn that early on and we go through it, I don't know, for whatever reason it's perceived as weakness to share, but I always tell folks that come in and see me that that's the strongest thing they can do. That's the toughest thing they can do, And so I think just throughout life we're told those silly sayings like boys don't cry, and it carries on throughout life and really makes a mess later.
Yeah, absolutely. All right, we'll take a break. Stay with us, please. And this is Mon Health Talk Radio. For this Monday, again, Thomas Drvar, licensed clinical psychotherapist with Mon Health Wedgwood Primary Care and Psychiatry. When we come back, we'll have Thomas tell us how you can get in touch with him, or perhaps someone in his office if you have some things to work out. This is Mon Health Talk for this Monday. We'll continue the conversation after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us on WAJR. Thomas Drvar, licensed clinical psychotherapist, with us from Mon Health Wedgwood Primary Care and Psychiatry. We're talking mental health, and today specifically men's mental health. So, Thomas, there's somebody out there who's struggling with something, and maybe something you said today resonated with them. What would you say to that individual that may influence him to pick up the phone and maybe take that first step?
It's always one of those things. If you've got to ask the question, like, do I need help, then that's usually a good sign that that's the case. And so I would just really tell anyone that's listening, it's not something that is as scary as you think it is. I see a therapist, and it's something that I have to do to maintain my well-being. And so it's not always the easiest to walk in or have these conversations, but it gets so much better. And I want people to be healthy in life and make sure that they're, achieving the best they can. So just give it a try. And if you come in and you see us once, you don't have to come back again, and that's fine. But at least you tried it and planted that seed for maybe future sessions. And if you do sign up, you don't have to go into major things the first time. We can talk about small things just to get more comfortable with having conversations in an office. So just give it a try. And it's one of those things, very rarely, if ever, over 16 years, have I heard someone tell me this wasn't good, or I didn't, this was as bad as I thought it was. I don't think I've ever heard that. So I don't want to say I can guarantee it's not going to be a bad experience, but it's something that you owe it to yourself, you owe it to your family, just to get in there and try to get some support.
So what you try to do is give people kind of tools to deal with their issues, right? Positive
Absolutely.
steps instead of negative behaviors and steps.
Yeah, exactly. And what we do is some of the easier stuff, like, even just trying to identify some of the things that folks struggle with. I also think that, like we talked about earlier, those hobbies, not only is it trying to reduce the negative symptoms, but we're also trying to increase the positive. Like, the hobbies, being with family, like even today, having this call is a little nervous, and I've got my support here, my daughter. And
Hi there, what's her name?
Jillian.
Hi, Jillian.
And so it's not all bad. What we're doing is we're just sitting back and we're saying, okay, what's the negative? What's going on? What's the positive? How do we increase that? How do we reduce the negative? And I say it not jokingly because it's all very serious, but, if someone comes in and they say, work is incredibly stressful, I have financial issues, maybe I'm having some relationship issues, I'm not sleeping well, and I haven't had a fun day in, a year or so, and I'm depressed. Yeah, that sounds right. And so what we need to do is increase those positive things, start to reduce those negative, and help get somebody on track.
Mm-hmm. And I would imagine you see a lot of people that wait too long. They're having these issues, and they compound it by either making some really bad decisions, or they they do something maybe a step too far. What I'm saying is, don't wait till there's a crisis, right? If you're
Exactly.
uncomfortable, if you're not feeling it, then do something about it.
Right. These issues will continue to compound, and if we were able to just bully through with strength, or just get through this on our own, then we would. But obviously that's not something that we're able to do. And if it goes on, the earlier the better. It's just much better, because these things do continue to compound. It only gets worse. And so the less issue that we have to deal with, the faster we get moving and the quicker people get better. And so definitely coming in and, see folks that wait too long, and that's also okay. If you've waited too long, that doesn't negate treatment. That doesn't mean that you're not going to get better. So at any point that you're struggling, please get some help. But yeah, the sooner the better, for sure.
What about the telehealth option? If somebody just the barrier for them is going to someone's office and sitting and laying down, what about the telehealth option? Is that on the table?
Oh yeah, telehealth is great. And you know what? I have someone that I see that on Tuesdays, I see them via telemedicine. They go to their car during their lunch hour and they eat, and we talk about it. So they're not even having to really change their day. We schedule it during their lunch hour. You can do it from the comfort of your home. You can do it from the job site in your car. It's very much confidential. Nobody knows who you're talking to or FaceTiming with. For all they know, I'm their brother or something like that. So even if you'd be out and someone walks by, it's completely safe, and that's definitely one less barrier you have to work with if that's something that's getting in the way of getting help.
How many people do you deal with that have the employee assistant programs? Is that fairly common?
We have a good bit, and there's a lot of good companies out there that not only do they want people to perform better at work, but they also want their employees to be happy and healthy and live good lives. And so, that's something that we see, whether it be within hospital workers or different fields, and definitely check in with your HR, with EAP. We work with anybody. We never want an insurance or something like that, or a schedule, to be a barrier to get help. So we will always work with somebody to try to figure out how we can best get them as much treatment as we can without, creating more stress in their life.
Okay. All right. So how do people get in touch with you?
So the best thing to do is just give us a call. And our number is 304-599-1975. We have the best people answering the phone. Ashley and Joyce do an amazing job. Stop in. If you're somebody that hates picking up the phone, we're located in the Mon Health Plaza in the 1000 building. So just stop in and just say, hey, I need to see somebody. I want to come in. And you can schedule in person. Or if you have a family member that you're bringing in, we'll have, someone bringing their kids in and they're sitting in the waiting room, just ask for an appointment while you're there waiting for their appointment.
Mm-hmm.
We'll get you scheduled and we'll get you seen.
All right, 304-599-1975. That is Mon Health Wedgwood Primary Care and Psychiatry. And again, give them a call or the website, monhealth.com. That's an easy way to get in touch with someone as well. Well, this was great. We appreciate your time. Thanks for coming on.
Thank you so much. I really appreciate it.
Thomas Dravar with us, and Jillian. Thomas Dravar, a licensed clinical psychotherapist.
This is Mon Health Talk, a weekly program focusing on the dedicated